Ever noticed that you're feeling wet down there, even when you're not turned on, and wondered why? You're definitely not alone. Let's unpack what's normal, what's not, and when it might be time to check in with your body. Hi, I'm Dr. Camilla, host of the Intimacy Lab for Ubi Health. As one of the AI faces of Ubi's global network of over 1,200 medical providers, and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to sex, sexual health, relationships, and intimacy. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust, which is exactly what we're doing today. Let's talk vaginal wetness. First, it's healthy. Vaginal discharge is your body's built-in system for cleaning, lubricating, and protecting the reproductive system. In fact, a typical vagina produces up to 4 milliliters of fluid per day, and that can fluctuate big time depending on your hormones, stress, activity level, and even your mood. Now, wetness during sexual arousal is the one most people know about. Thank you, dopamine and blood flow. But here's what's really happening. When you're turned on, your brain signals increased blood circulation to the pelvis. That causes fluid from your cervix and Bartholin's glands, small glands located near the vaginal opening, to increase, making things wet, slippery, and ideally, ready for intercourse or other intimate touch. It's not just about pleasure, it's biology helping keep things safe and smooth. But arousal isn't the only culprit. Ever noticed more wetness around the middle of your menstrual cycle? That's ovulation, when estrogen peaks and cervical mucus becomes stretchier and more abundant to help sperm move toward a potential egg. This kind of discharge is a great sign that your cycle is doing its thing. Another common factor? Hormonal shifts. People on birth control, in perimenopause, or during pregnancy may notice changes in their baseline wetness, more or less, depending on how estrogen is fluctuating at the time. I had one patient in her late 20s tell me she thought she had an infection every month. Turns out, she was just ovulating. Once she learned what her natural pattern looked like, the stress disappeared. Of course, not all wetness is good wetness. If your vaginal discharge changes color, say to gray, green, or yellow, or comes with a foul smell, burning, itching, or swelling, it might be time to check in with a doctor. One of the most common culprits is bacterial vaginosis, or BV. It can cause an increase in discharge and sometimes a fishy odor. Thankfully, it's common and treatable. Same goes for yeast infections and some sexually transmitted infections. Your vagina will often tell you when something's off. Trust those instincts. Certain medications can also impact wetness, especially hormonal birth controls or even antidepressants. If you've started a new medication and your discharge feels different, it's worth bringing up with your provider. Again, normal looks a little different on everyone, but sudden changes are worth noting. So, what can you do at home? Wear breathable cotton underwear and avoid overly tight clothing when you can. Skip heavily fragranced soaps and douches. They disrupt the vagina's natural microbiome. Stay hydrated. Yes, it really can help regulate mucus production. Track your cycle, especially if fluctuation in discharge is causing confusion. Bottom line? Vaginal wetness, whether it's happening during sex or while you're just living your life, is usually a sign that your body is functioning exactly as it should be. Worried about your own symptoms or just want to check in with your body? Start by using the Ubi Symptom Checker at ubihealth.com. Its medical-grade, doctor-approved AI is like having an on-call healthcare team right in your pocket, always 100% free. Like and follow for more doctor-approved info you can trust from Ubi Health. You're not broken. Your body is talking. We're just here to help you understand what it's saying.